All right. Hello, everyone, and welcome to the food systems session of the second annual NorCal Symposium on Climate, Health, and Equity, co-hosted by Stanford Medicine, UC San Francisco, and UC Davis. My name is Sohaila El-Deeb, and I'm a biology undergraduate at Stanford University. We are very excited to welcome you all here today as we discuss the importance of the intersection of food with climate and health. And before we dive in, I'm honored to present our amazing planning team. Oh, sorry. There we go. All right, Marcella Radke, Aude Bonois, Dr. Reshma Shaw, Dr. Karina Marr, and Dr. Barbara Ernie. With that, I'd love to tell you why we are focusing on food systems today. Food systems is a significant topic that was chosen this year. Between farms and plates, most food-related greenhouse gas emissions are from producing food, particularly beef and dairy. Food systems activities, including producing food, transporting it, storing wasted food in landfills, produce greenhouse gas emissions that contribute to climate change. Human health is both directly and indirectly impacted by the climate crisis and food systems, disruptions by diminishing food security, which is a key determinant of health. Human health may also directly affect by the physical effects of climate change on the food system, primarily through pathways of food safety and nutrition. Healthcare leaders have a profound role to play in understanding the health effects of climate change in communities, specifically how food plays a role within that. These communities are necessary to center and partner together in order to achieve a healthy, sustainable future for everyone. Therefore, our goal is to emphasize that intersection of food equity and community work. Today, you'll learn about climate change in the lens of food, the health and equity issues in communities made vulnerable by food disruption, and most importantly, concrete solutions and ways to change practice that can address these inequities and improve care and health for everyone. We encourage you to
You're muted, Sohaila.
Oh, sorry, did you hear anything I said?
We encourage you. That's where we lost you.
Oh, okay. Perfect. Sorry, I don't know why that happened. All right. We encourage you to open your minds and hearts to listen deeply and to be changed by what you hear. And most importantly, leave here today with some actionable next steps. We also invite you to join us in building an ever-growing community of health professionals, students, and community members learning and working together towards climate and health justice for all. So with that said, I'd love to overview our agenda for the day. We'd love to lay out that we'll first hear from keynote speaker, Dr. David Katz, who we are fortunate to have him here with us to answer questions from all of you today after his talk. And afterwards, we'll have a lightning round where we will hear from 5 different speakers, Marcella Radke, Rachel Shaw, Hilary Bass, and Jared Johnson. Then our 5th speaker will wrap up with a few words from Dr. Reshma Shaw and a wrap up from student leaders with some actionable next steps. So before I hand it over to Marcella for the introduction of Dr. David Katz, I'd love to just lay out some housekeeping rules to keep in mind. Please remain muted at all times to ensure speakers are heard. We encourage video on so you're able to be fully engaged with the speaker. And 3, when we transition to the Q&A, please put all of your questions and comments into the chat for the moderator to be able to read them out loud. And at any point of technical difficulty, please feel free to private message me. With that, I'd love to transition over to Marcella for the introduction of our keynote speaker.
Good afternoon, everyone, and welcome again to the food systems segment of the NorCal Symposium on Climate, Health, and Equity. My name is Marcella Radke, and I'm a doctoral candidate studying nutritional biology at the University of California, Davis. It is with great pleasure that I introduce you to today's keynote speaker, Dr. David Katz. Dr. Katz received his medical degree at the Albert Einstein College of Medicine in 1988 and was quickly overcome with the desire to expand his reach beyond the clinic. He completed his master's in public health at the Yale University School of Public Health in 1993 and has been transformative in the field of public health nutrition ever since. In April of 2019, I was fortunate to attend Dr. Katz's Distinguished Consuna Lecture presentation at UC Davis. This talk not only reframed my personal perspective of the role of nutrition in chronic disease development in modern society, but evidently put Dr. Katz at the forefront of a public health movement, one that would acknowledge health disparities, socioeconomic challenges, race, ethnicity, and climate degradation, among others. Dr. Katz recognized the systemic issues plaguing both planetary and human health years ago and has been providing tangible and actionable measures for improving health outcomes in humans and the environment. Dr. Katz is the founder and former director of the Yale University's Yale Griffin Prevention Research Center, founder and president of the nonprofit True Health Initiative, and founder and CEO of Diet ID, a novel dietary assessment tool. Dr. Katz has vast experience in the realm of science communication, authoring and co-authoring over 200 peer-reviewed publications, 19 textbooks and books, hundreds of newspaper editorials, and has an impressive online social media presence with over 1 million followers. With his philosophy focusing on the confluence of human and planetary health, Dr. Katz aims to translate nutrition science into actionable change to improve human and environmental well-being for current and future generations. Today, he will be presenting Eating Like the World Depends on It. Please, everyone, join me in welcoming Dr. David Katz.
Wow. Marcella, that was one of the loveliest introductions I've ever had and ever heard. And I'm just, I'm awed by such kind words. I appreciate them very much. And Sohaila hit all of the relevant highlights. So I really think we can just skip right to the Q&A and save ourselves a lot of time and fuss. You probably want me to say something just the same. So I will. Delighted to be with all of you. Thanks so much for having me. I am cut from the typical academic cloth. So inevitably, I've got 2 hours worth of things to say and 20 minutes to say them in. So please forgive me from the outset here for what will be a very brisk and, on my part, perhaps breathless pace, and away we go. Let's talk about what diet can do. Arguably, we've known about the profound influence of diet on every aspect of health since Hippocrates. But Marcella was kind to mention I completed my preventive medicine residency in MPH in 1993. That's really when my career began in earnest. And almost concomitant with the completion of my study in preventive medicine, this paper came out in JAMA, Actual Causes of Death in the United States. If you're not familiar with it, I commend it to you. I consider it one of the cornerstone publications of the modern era of lifestyle medicine. In this paper, McGinnis and Fege enumerated the 10 root causes of death, not what gets listed on death certificates, but what causes that stuff, that account for virtually all the premature deaths in the US every year, but for a rounding error. For our purposes today, though, we needn't concern ourselves with the full list of 10. We'll focus on just the first 3. Tobacco, poor diet, lack of physical activity, or as I've summarized them ever since, bad use of feet, forks, and fingers. These account for 80% of the action. Get this right. Don't smoke. Eat optimally. Be physically active. 80% of premature death and chronic disease could go away. And this isn't just one paper. It was reaffirmed 10 years later. It's a repetitive drumbeat in the peer-reviewed literature. We now jump forward the better part of those 30 years to 2019. We get this op-ed in the New York Times by Dariush Mozaffarian, whom many of you know, Dean of Nutrition at Tufts, Dan Glickman, former Secretary of Agriculture of the United States. Our food is killing too many of us. Interestingly, provocatively, this wasn't long before the start of the COVID pandemic. And what this op-ed pointed out, basically channeling the peer-reviewed literature I'll come to momentarily, is that more than 500,000 of us in the US die prematurely from poor diet quality every year. Now, remember what we did when we crossed that threshold with COVID. We had a national moment of reflection and mourning, and rightly so. But that many of our fellow citizens die prematurely of poor diet, something over which we exercise complete control every year, and we have no national moment of mourning and reflection. It just hides in plain sight. Year in, year out, more than 500,000 premature deaths in the US every year. Diet is the single leading predictor variable for all-cause mortality in the United States today, and increasingly around the world. Talk about an issue of social justice. We have effectively exported this malady. And so now dietary factors are among the leading causes of premature death and chronic morbidity in modern countries all around the world. Now, this is from the Global Burden of Disease study, and I typically have recourse to the peer-reviewed literature as to
I will ask Dr. Katz. It seems that he may be having Wi-Fi connection. One second.
Yeah, I think so.
No problem. We'll. All right, we have Dr. Katz back on.
There you are. Cannot hear you though.
Okay, interesting. This is going to definitely challenge the 20-minute timeline. When did I drop out, folks?
Oh, not long ago.
Not long ago. Did you hear me talk about
Yeah, you're
Mark
talking about
Bittman's book?
COVID. Yeah, COVID and the pandemic, and yeah, just right there.
COVID and the pandemic. I have no idea where that left me. Did you hear me mention Mark Bittman's book, Animal Vegetable Junk?
No.
Alas. Okay, so diet kills more than 500,000 of us prematurely in the US every year, leading cause of premature death in countries around the world, Global Burden of Disease study. And to understand the history of how it came to be so, I commend to you the book newly published by my friend and colleague, Mark Bittman, Animal Vegetable Junk, and we'll leave it at that moving on. And yeah, somebody alert me if we've got any technical issues, because I may be blind to them. The profound effects of diet on every aspect of health reverberate to our innermost selves, even within the double helix of DNA. When we entered the genomic age, there was some notion that DNA was destiny. Of course, we've moved on from there and we know it's not, but dinner is, because diet and lifestyle affect the epigenome, 95% of our chromosomal real estate, which has a massive influence on what our genes do. You can't change the genetic hand you're dealt, but you absolutely can alter what your genes do. Dial them up, dial them down, turn them on, turn them off. That's what the epigenome does. Diet and lifestyle influence that. But what's shown in this image is not just a pair of chromosomes, but those green caps, those are telomeres. And we also know that diet and lifestyle can actually change the length of telomeres, one of the most potent predictors in all of biology of healthy lifespan. Other things being equal, you can have very long telomeres, still a bad idea to stand in front of a moving train, but other things being equal, long telomeres, long healthy life. And this is actually work that resulted in a Nobel Prize in Medicine to Elizabeth Blackburn at UCSF, in the mix here today among the Northern California universities. We also know, okay, having more fun with the slides. We also know that diet is an acute factor during the pandemic. This is a publication that just came out very recently, just a couple of weeks ago, showing that objective measures of diet quality track with COVID outcomes. In other words, higher diet quality, lower risk, other things being equal. So even given adjustment for presence or absence of chronic disease, age, lower risk of severe COVID disease with higher diet quality. This is just a study of association. It's obviously not a randomized intervention trial, but it's consistent with a lot of other literature, and I think we can trust it. So diet is an acute defense. Diet is a chronic defense. Diet is the very best of medicine. And we know that the prior pandemic, the one we carried with us into the pandemic of SARS-CoV-2, has made an outsized contribution to the casualty toll. This estimate in the Journal of the American Heart Association is that 60% of the hospitalization and death in the US could have been avoided during the current infectious disease pandemic if only we had addressed the diet and lifestyle induced pandemic of chronic disease we had with us all along, the one that hides in plain sight, the one that evokes inadequate outrage. I've argued throughout the pandemic that actually two pandemics are better than one. If this was all just due to a virus over which we had incomplete control, we'd have to hide away, wait for vaccines, which thankfully came fast, and that sort of thing. If it's largely related to our health status too, well, then we have the opportunity to use diet and lifestyle as medicine and fortify ourselves against the threat of COVID. And so there is another way to get a booster. Yeah, you can get it with a third or second vaccine, but you can also improve your diet, your physical activity, your sleep, the other aspects of lifestyle as medicine, and make a massive contribution to the vitality of the immune system. As a preventive medicine specialist, I've looked at this situation thinking all along we could put people in risk tiers by age and health status. And while we can't alter chronological age, we can alter biological age, and we certainly can change health status. And the white arrows in this grid that I published many months ago are all opportunity, largely neglected, by the way, to move people from higher risk, where it's more likely to get severely ill, more likely to wind up in the hospital on a ventilator or die, to those cells where it's much less likely that any of that will happen. I think we have systematically neglected, and I would argue this is a social justice issue, as I'll come to momentarily, the opportunity to get healthy together during the pandemic, and by addressing what was here all along, have a much better experience with the acute threat of COVID. The issue of social justice has been highlighted in the New York Times, among other places. I actually published with colleagues a paper in the Journal of Emerging Infectious Disease on the overlap of COVID risk factors and populations subject to disparity and disadvantage. This was picked up by the New York Times. And so, not surprisingly, perhaps, places where people have the highest burden of chronic disease, have the poorest quality diet, and oh, by the way, are essential workers who can't work remotely but have to be on site, were all basically caught up in the acute toll of COVID and have had an outsized representation in the travails of the past 2 years. This is all consistent with my personal experience. I am a 30-year clinician, now retired from clinical medicine to focus on public health, but I came out of retirement to volunteer during the surge in New York City, served a stint in an emergency department in the Bronx, and I saw this up close and personal. You know, it was people from select neighborhoods with that constellation of disadvantages, social disadvantages, lifestyle disadvantages, economic disadvantages, injustice, all of that adding up to a much greater risk of winding up in our ICU. Okay, so we know what diet can do. It's a profound effect on everything that matters to the human condition. Do we know what diet can do all that? We do. Michael Pollan got it down to 7 words. I wrote a book called The Truth About Food a couple of years back. It's 200,000 words. And I joke at the end of the book, this book, The Truth About Food, should have been 7 words and they wouldn't even be mine. They'd be Michael's. Eat food, not too much, mostly plants. Thanks for coming. Mic drop. The other 199,993 words are why it's so hard to rally around this simple fundamental truth. I have devoted my life and my career to advocacy for this truth because I've seen it through every lens that I have applied. Peer-reviewed papers like this one I was asked to write in 2014, multiple books, both textbooks. And by the way, the 4th edition of Nutrition and Clinical Practice, which is a text for health professionals, is in press right now. But books for the general public, like The Truth About Food, all proceeds of which, by the way, go to the True Health Initiative, and then the recent book with Mark Bittman, same answer every time. Eat food, not too much, mostly plants. If you mostly eat vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and drink plain water when thirsty, you just can't go too far wrong. Better for you, better for the planet, better for our fellow creatures, better for everything. And I like all kinds of evidence. I'm sort of an evidence agnostic. I've conducted and published RCTs. I've conducted and published meta-analyses, systematic reviews. But frankly, what happens to whole populations over spans of lifetimes and generations cannot be derived from a randomized controlled trial. And the blue zones tell us that. So if we look at the spectrum of blue zone diets from animal food predominant, ultra-processed food predominant in red on the left, to plant food predominant, real food predominant, in black or green, whatever that is, I guess that's green over there on the right, all the blue zone diets, very diverse, cluster on the right end of the spectrum. Plant food predominant, real food predominant. That is the answer. I also think, and this is clearly germane to the proceedings here today, we should be looking at the effects of diet through three lenses, not one. Physician though I am, it's not just about what does diet do to humans. It's about what diet does to the planet, what diet does to our fellow creatures. And if we look through those three lenses, the argument for plant predominant or even plant exclusive diets gets much stronger. Because there's no question, our diets are cooking the planet. Our high consumption of meat and animal foods, our high consumption of ultra-processed foods and the factory processing that goes into their generation comes at a massively high cost in greenhouse gas generation, in water utilization, land use, toxification of the environment, and the destitution of fragile ecosystems and biodiversity. So essentially, we take the gems of the planet, like this image of the Amazon, do this to it, so we can do this and graze cattle to produce more of this. And we might be inclined to just blame the crazy president of Brazil, Bolsonaro, but frankly, it's the global appetite for meat. It is the demand that justifies the supply. It's the economic imperative. We all have a hand in this. And so we really have to raise awareness around the world to cut off the demand, because demand will alter the supply quite reliably. I was asked a few years back by NPR, how bad really is red meat? And they expected me just to talk about saturated fat and animal protein. I said, we can. And yes, it's bad. But if we look through the three lenses, is it bad for human health? Yes. Is it bad for our fellow creatures who are abused and treated cruelly and incarcerated and slaughtered prematurely for our consumption? Hell yeah. And is it bad for the planet? No question about it. Viewed through those three lenses, we need to massively reduce our intake of meat. Plant-based meat is not a panacea because, frankly, these are generally highly processed products, and it's unclear as of yet how good they are or are not for human health effects, for cardiometabolic markers. But this is somewhat ironic. I would argue that if we invoke those three lenses, how does it affect humans? How does it affect fellow creatures? How does it affect the environment? The final current word on the topic of plant-based meat is courtesy of a guy named Meatloaf. 2 out of 3 ain't bad. We know it's better for creatures other than humans, and we know it's better for the environment. Whether or not it's better for human health, 2 out of 3 ain't bad. I view these as gateway drugs for people who are disinclined to actually just go ahead and eat vegetables and legumes. And for those of us who really like beans and lentils, we don't need these products. But for those who don't and have a carnivorous palate, great way to engage with them. So I actually very much welcome this trend, because I think what we need to do is stop preaching to one another. We're already here. We're already in on this. We need to reach others, right? This has got to be at scale, and I think this will help. Fundamentally, we are constitutional omnivores. You may have heard other depictions, but this is the truth physiologically, anatomically, and historically. But that simply means we have choices. And 8 billion hungry Homo sapiens cannot do what scattered, isolated bands of foragers did in a vast, empty world of seemingly infinite resources. Dorothy, we are not in the Stone Age anymore. We have choices. We need to make good ones. And we have the opportunity to make the choice of a grand confluence, because fortunately, shifts in diet quality for human health and for the sake of the planet run together. This is highlighted in many fine publications. The one I cite most routinely is the Eat Lancet Commission report on food, planet, and health. So yes, we can eat better for our own health. We can stop drying out our aquifers. We can preserve the Amazon. We can stop torturing domestic animals. And we can stop cutting down trees that orangutans should be climbing in Borneo from our palm oil plantations to produce more ultra-processed food. We can do all of that. If we look at the Venn diagram of dietary patterns best for human health, dietary patterns best for the environment, maybe they overlap completely, maybe they don't, but there is a substantial sweet spot where what's good for us is good for the planet too, and it's kinder and gentler, both to our fellow creatures, but also to one another. And here's the social justice issue, because we're talking about innovations in food production that democratize access to food. Importantly, we manage what we measure. This is actually an expression from the business world. It's true in medicine as well. We routinely measure vital signs. And I think diet, since it's the leading predictor of premature death and chronic disease, deserves to be a vital sign. In that op-ed in the New York Times by Mozaffarian and Dan Glickman, they went on to enumerate potential remedies to food as the leading cause of premature death and said, for one thing, we should be looking at diet quality routinely. It should be in everybody's electronic health record. Well, we need tools to make that possible. The American Heart Association has specifically called for the development of such tools. And actually, I've devoted the recent years of my life to that very endeavor. This is what we've done at Diet ID. It's an image-based dietary assessment. We ask which of these looks more like stuff you eat, A or B, A or B, A or B. We can get you in 60 seconds. That's compared to 90 minutes for a food frequency questionnaire, 7 days for a 7-day food diary, and on it goes. And so we have a whole new way of assessing diet based on pattern recognition. And that creates a new world of opportunity. You can learn more if you'd like at dietid.com. But what I want to tell you about today is how we can leverage what we've done there for a new project called Diem, as in Carpe Diem, because folks were running out of time. Let's seize the day. Dietary impacts on environmental measures. We are fortunate that we don't have to choose between what's good for people, what's good for the planet. It's one and the same. This has been addressed many times, not just in the Eat Lancet report, but a number of papers out of Oxford University in particular, Marco Springman, for example. So they've looked at diverse human health effects, various chronic conditions, premature death, and diverse environmental effects. So A is human health effects, B is planetary effects, scan across this. Lots of component measures, but a very clear and simple message. Everything in green is good. And here it's shown at a glance. What's the good stuff? Vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, all the usual suspects. Eat real food, not too much, mostly plants, better for people, better for the planet. So what we're looking to do is take advantage of the diet map we created at Diet ID, diet type on the x-axis, diet quality on the y, all translated into images, and figure out how to quantify the diagonal. As diet quality rises and we move from animal food predominant to plant food predominant diets, we can quantify environmental impact reduction. We're working on this right now. We're going to appify this. We're going to empower everybody to know, if I change my diet from this to this, how much does it reduce the overall environmental footprint of my diet? This will be our signature contribution to this critical and timely effort. So it's a new index. We have world-leading experts working with us. The project has been moving along in fits and starts for a couple of years, but it's accelerating and moving toward the finish line now. And again, we hope to be able to say next time we gather, this is available in an app store that you can take advantage of. A couple of other quick notices here, and then I'll wrap up. There are great efforts to engage health professionals in this effort. Planetary Health Alliance, founded by Dr. Sam Myers at Harvard. Sam and colleague Howard Frumkin are authors of this terrific book, Protecting Nature to Protect Ourselves. So really, I think the definitive text on planetary health. I was involved in the launch yesterday of Food and Planet. This is an organization to engage in particular with nutrition professionals to address the confluence of these two things. And on matters of social justice and the democratization of food production, none is better than Danielle Nierenberg and Food Tank. So I commend all of that to you. I want to close, and I don't know whether I'm slightly off the timeline because of our technical glitch. Let's see how I'm doing. Yeah, 20 minutes, 42 seconds. I'm going to take another minute here. So I think the signature challenge to everything that matters in this fraught time is discord. Our inability to listen and attend to opinions other than the ones we already are, and even to agree to disagree at times. Because as we've all heard, only in unity is there the strength to do the necessary hard things. And we can't win this war by preaching to one another. We're already converted. We're already members of the same congregation. We have to reach others. We need more bridges, fewer bunkers. We have to find new ways to cultivate common cause on common ground and a shared hope about the future we could all experience together. This is Emily Dickinson. Hope is the thing with feathers that perches in the soul and sings the tune without the words and never stops at all. And sweetest in the gale is heard, and sore must be the storm that could have bashed the little bird that kept so many warm. I've heard it in the chillest land and on the strangest sea, yet never in extremity it asked a crumb of me. So Ms. Dickinson concludes that hope asks for nothing and just gives. I'd like to offer a corollary. Hope must be fed. We must feed it in one another. We have to be the change we want to see in the world and do everything we possibly can to keep one another strong, keep one another at it, and pay the critical messages forward. We know enough. We just don't do enough with what we know. And with that, I will wrap. If I've gone over, I apologize. Happy to take questions.
Wow, thank you, Dr. Katz. Wow, every time I hear you speak, I just get so inspired, and I'm sure the crowd is feeling exactly the same. So right now we'd like to open up the chat. If you have any questions for Dr. Katz, please go ahead and post those. I have hundreds I feel like I could ask you at this point, but I'll just start with a couple. So one of the big things that we've been seeing over the last year and a half, and seeing you in the front lines of it all, I'm sure you have a wonderful perspective on this, is that relationship between diet and COVID-19 that you mentioned. And one of the areas that I've found fascinating and disheartening is the distrust within the medical community from community members. And so my question for you is, how should we go about dietary recommendations for communities when they don't trust the medical field?
Yes, we've done a lot to damage trust. The whole issue of pandemic response it is a topic that could take up a lot of time in its own right. As some of you may know, I actually opined what I had to offer was essentially this, the view from altitude. I'm the guy who typically can see the elephant in the room. I may not be nearly as expert in specific anatomical parts of the elephant as others, but I generally can see the big picture. So actually, I had an op-ed in the New York Times arguing that, the pandemic is going to hurt people in more than one way. Some people will be hurt by the virus. Many will be hurt by social inequities. We really need to think about total harm minimization. We really need to think about who needs what. Some people need assiduous protection from the virus, people in nursing homes, for example. Some people who are young and healthy probably don't, but they're more concerned about the economic impact and supply chain disruptions. Total harm minimization should be our goal, a risk stratified approach, and then a communication campaign could have followed that. Frankly, we bungled it every which way. Obviously, we had, at the time of the critical early phases of the pandemic, we didn't have grownups running the country. That was a problem. We had public health agencies trying to say things they weren't allowed to say because the administration opposed that view. And I think we've been playing catch up ever since. A lot of harm has been done to the credibility of CDC, the FDA, health professionals in general. And now we've become extremely polarized. So frankly, everybody manages to be wrong in opposing directions. I mean, we sort of had the choice. Look, there are two camps here. You can either say hunker in a bunker forever because it's never going to be safe to go out, or liberate my state. And, I think because we polarized the dialogue, we have lost the ability to find common ground in the middle. That's what we have to work on. And, I think we can perhaps start to populate that patch of common ground by pointing out to people, actually, there are ways for you to take matters into your own hand that are outside that dialogue of who should be wearing a mask when and what kids need to do in school. And do you have to be vaccinated or is it a choice? I've got my opinions on all those topics, but this isn't the time or place. But you can promote your own health and the health of people you love in a way that is the gift that keeps on giving. It's an acute defense against the threat of an infectious disease. And oh, by the way, long after this pandemic is over, because all pandemics do end, it will contribute to years in your life in your years. Let's talk about that. The one other thing I would say, in my years running the prevention center at Yale, we did community-based participatory research. And I think that general method is directly germane to your question. You don't assume you know the answer. What you say is, I know what I know, and you know what you know. Let's get together and figure this out. So talk to me about your community. Where is the distrust coming from? How could I get you to trust me? What do I need to do? How can I be helpful? What are your priorities? Help me understand. Educate me before I try to educate you. I think this notion of partnership and dialogue, as opposed to, hey, I'm from academia, I have all the answers, be quiet and listen to me, basically monologue by fiat, dialogue works much better. I think if I have to sum up, the best way to cultivate trust, funny from a guy who's doing all the talking, shut up and listen.
Yeah, that's amazing. I love that. And then my last question before we turn it over to some of our audience members is, I know a lot of us here are really interested and passionate about food insecurity. And of course, over the pandemic, we've also seen fluctuations in food access. And so my question for you is, for individuals who are in low income or marginalized communities with limited access to sustainable food or produce, how might they prioritize nutrition and food security from an environmentally conscious lens?
Let me fold your question. I'm looking at the chat, guys. Great questions, and obviously, look, I've got a total of 25 minutes. I didn't cover everything there's to cover. One, I hope, revelation for all of you. We published a paper, I think it was 2011, Public Health Nutrition. We had a couple of valid measures of the overall nutritional quality of foods. And I was interested in testing the urban legend that more nutritious food always costs more. I mean, that's what everybody says. We say it to one another, but I'm a scientist. You hear stuff like that and say, have you got data? And, nobody ever did. Yes, to eat optimally, lots of fresh produce costs more than eating poorly, but is it really true that you have to spend more money to eat better? And I'm here to tell you it's not, that actually the cost of food per se is not the particular barrier. And frankly, even in a bodega, you can generally find canned beans and rice. It's just that most people don't know what to do with it anymore. People don't know how to cook. So we've got a food label literacy issue. People don't know how to identify more nutritious food. We've got a food management literacy issue. People don't know what to do with food. But we did a study where we actually looked at every aisle in the supermarket, typical supermarket, middle of America, everything that comes in a bag, box, bottle, jar, and can. We left produce out because we know produce is better for you and more expensive. So we need subsidies there and coupons and so forth. And there are many of those programs like Wholesome Wave and others that do exactly that. What we found is that every aisle of the supermarket offers more nutritious foods that don't cost more, but people don't know how to recognize them. They also offer pseudo-nutritious foods that cost more, that aren't really selling better nutrition. They're selling marketing hype, like multigrain bread, which isn't whole grain, or fortified cereals made from junk plus a multivitamin thrown into the gloop at the end. And people buy that stuff. Low-fat peanut butter, which takes out healthy oil, adds sugar and salt, and people pay more for that. So there are many barriers caught up in what we talk about as financial issues that aren't necessarily financial. So we need to look broadly at this. We did another paper years ago on barriers to fruit and vegetable consumption. It's not just price. A lot of people don't know what to do with vegetables. Plus, if you buy a peach or an apple, sometimes it's great. Sometimes it tastes like plastic. If you buy Doritos, they always taste like Doritos should. And people think I'm reluctant to spend my hard-earned money on something that may not be a good version of tomato or apple or peach, or Doritos never let me down. We've got to solve that problem too. On the issue of deserts and swamps, look, we could have a lengthy discussion. If I ran the zoo, I do have ideas about how to address that, including mobilizing healthy food, right? Electric vehicles that take healthy food around to those places where it's not routinely available, subsidies, incentives, behavioral economics. I mean, there are all sorts of things. And then who should pay for all of this? The health insurers, Medicaid, who's paying the cost of all the disease. Basically, you think about the SNAP program now, we subsidize bad food to help poor people get to poor health and spend a fortune on that, $80 billion a year, and then spend a far greater fortune to pay the cost of that poor health through Medicaid. Everybody loses. People get bad diets, bad health, taxpayers get bilked, and the government runs out of money. Everybody loses. We could flip it around and fix it. So anyway, yes, these are fixable problems, but they're not fixable with the things we're discussing here today. They're systematic, they're policy related. We do need to invoke behavioral economics. We do need the government to weigh in. Some things need to be regulated. Some things could be achieved through private sector and the mobilization of economic forces. Too big a discussion to have under the time pressure of this. The questions are excellent. All of this does need to be addressed. I think probably the most important message I can leave all of you with is that it is addressable. Don't think any of this is insoluble. If we can imagine a solution is possible. And I can imagine a solution. I'm not as young and as visionary as you guys are. So yes, we can solve this. We just have to want it badly enough. And we have to engage enough other people so we have the political capital to get it done.
Wow, thank you so much, Dr. Katz, for being with us today. And I invite you all to look up Dr. Katz's Diet ID as well as the True Health Initiative, and we'll provide his contact information as a follow-up from the symposium. So really, this was invaluable to hear from such an expert in the field, and it was an honor to have you here as a mentor and really someone who's leading the charge on something that so many of us are excited to follow in your footsteps. So
thank you all. A pleasure, a privilege, and the world is counting on all of you. You know, we've made a mess of things. Sadly, it's your generation that's got to clean it all up. So get going. And thank you. Thank you very much.
Thank you.
Thank you again, Dr. Katz, for that wonderful discussion. I wish we were in person so you could hear a very loud roaring applause, but this will do. Now we'd love to begin our lightning round, where we will hear from 4 speakers first as they give a very brief overview of their work at their respective organizations. Thank you.
You're muted, Marcella.
Marcella,
Biology with an emphasis in Hi, everyone. My name is Marcella Radke, and I'm a 3rd-year PhD candidate at UC Davis studying nutritional biology with an emphasis in cognitive neuroscience. I'm excited to be here with you all today to share a little bit about my research, which focuses on understanding the physiological and cognitive impacts of food insecurity in the college student population. Today, I'll be sharing 2 studies with you all, with the first focusing on evaluating the efficacy of on-campus food access programs through the assessment of changes in diet-related biomarkers in college students. The objectives for this study were to determine if students utilizing the on-campus food access resources at UC Davis have improvements in biomarkers for health, as well as higher fruit and vegetable consumption compared to the students not utilizing these resources. The second objective is to validate Diet ID against biomarkers with dietary intake and diet quality. Diet ID is a novel dietary assessment tool that was developed by Dr. David Katz, who we were all fortunate enough to hear from earlier today. The assessments for this study included blood samples in which both plasma and serum were collected for carotenoid, lipid profile, and non-esterified fatty acid analysis. Skin carotenoid scores were collected using the Vegemeter. The Vegemeter is a device that uses pressure-mediated reflection spectroscopy to quantify the density of carotenoids within the tip of the finger. Anthropometric measures were collected, as well as dietary intake to calculate diet quality. Some of the preliminary findings for this study included a relationship between skin carotenoid scores and food security status, such that as students become more food insecure, their skin carotenoid scores decreased by 36.86 points, thus indicating a lower consumption of fruit and vegetables. The relationship between BMI and food security status was also observed, that as individuals become more food insecure, their BMI increased. As we know, BMI is a risk factor for a multitude of other chronic diseases, and so the relationship between BMI and food security status should be assessed in order to reduce the risk of a relationship between skin carotenoid scores and on-campus food access resources was observed, such that students who utilized the on-campus food access resources had improvements in skin carotenoid scores from time point 1 to time point 2. The second study I'll be sharing with you all today looked at the interrelationship between executive function, food security status, and stress in university students. The objectives of this study were to investigate how executive function is impacted by the experience of food insecurity among college students and to explore the interrelationships with indicators of diet quality. It was also expected to see results between major life events, including those experienced during COVID-19, on food security status, food selection, and stress levels. The methods for this study were entirely virtual, such that 600 UC Davis students will be recruited, with 175 already completing the study. This project is in collaboration with Diet ID and the National Food Access in COVID Research Team. The assessments include the USDA 10-item food security checklist, as well as the CANTAB assessment, which looks at various components of executive function, in addition to the perceived stress scale, the adverse childhood experiences survey, anthropometric data, demographic and COVID-related information, and diet quality measured using Diet ID. The implications and future directions include that the results from this study will improve diet-related outcomes in this population in order to reduce the risk of developing chronic diseases later in life. Interventions may include nutrition and food literacy education opportunities at the collegiate level, as well as the expansion of on-campus food access resources to increase the quality and quantity of health-promoting food items such as fruit and vegetables. Thank you all for listening today, and I'm excited to answer any questions that you all may have.
Hi there, my name is Reshma Shaw. I'm the director of the Center for Nutrition in Schools and an assistant research scientist in the Department of Nutrition at UC Davis. Today, I'll be talking to you very briefly about advancing nutrition research, food literacy, and food security through community partnerships. As the director of the Center for Nutrition in Schools, I just wanted to share with you a bit about our mission statement. With elementary schools playing a pivotal role in mitigating childhood obesity, promoting physical activity, and reducing food insecurity, the Center for Nutrition in Schools provides research-based, comprehensive nutrition programming to improve student health outcomes and nutrition-related behaviors. What you see here below are screenshots of 5 of our curricula that have been developed with critical community partnerships. I could spend all day talking about this, but I don't have time, so I will move on. In the center of the slide here, you see the social ecological model that's been adapted to the dietary guidelines for Americans. This is just an example from a study program called the Shaping Healthy Choices program. And the reason I wanted to highlight it is it just shows you here in bold and underline on the side, each of the different components for a program. And if you read closely, you can see that each of these components really requires the community in order to be enacted. And some of those community partnerships that we have leaned upon over the years are UC Cooperative Extension and CalFresh Healthy Living UC. Almost everything we've done has been in partnership with these 2 agencies specifically. We've also done a tremendous amount of work with different partnering universities and 2-year community colleges. We've worked with California Department of Public Health, and then of course the school districts and the school sites themselves, whether it be teachers, administration, school nurses, food service, et cetera. Really partnering with the schools has been critical. What I think is really something that you know comes to mind with successful community partnerships is the idea of synergy. So it's one thing, a university has great ideas, but when it comes to enacting those great ideas, you really need feedback from our community partners. So the boots on the ground, the partners who are working with the participants that we are trying to reach. So some of the things that have come out of this really fantastic synergistic partnerships, the first being a Nutrition 101 curriculum. So it's an online set of modules that were developed for nutrition educators. So our extenders, which is the second bullet here, if they wanted a little bit more background in nutrition before they went to teach lessons, they could use this Nutrition 101 curriculum. And our extenders sometimes are cross-age teachers, which just means it's a peer education model where we have slightly older youth teaching slightly younger youth. And then finally, another example of synergistic community partnerships is that some of our curricula have been translated into different languages, and really not just translated the words, but that they are translated culturally appropriate foods as well. At UC Davis, a lot of the work that we've been doing is shared on this slide. So study 3, you just heard from Marcella Radke, a doctoral candidate, about that. But studies 1 and 2 were done with another doctoral candidate, Britt Loofborough, the first being perceived barriers to healthy eating among UC Davis students, and the second one, knowledge, attitudes, and practices regarding CalFresh usage among UC Davis students. So these 2 studies are quite related and really focus in on understanding what causes food insecurity in students and how they are using food access resources to overcome this. Now, in a lot of what I've been sharing has not been necessarily related to healthcare, but when it comes to addressing food insecurity, really there's a role for everyone. And so just some examples of really fantastic programs that are ongoing. The first is a national program, the Fruit and Vegetable Prescription Program. And then several of the Kaiser locations across Northern California have weekly farmers markets, including the one right down the street from my house. And finally, another program, Vouchers for Veggies Eat SF, which provides vouchers for fruits and vegetables to low-income families in San Francisco. And that was just a few examples. There are many, many more. And finally, I want to wrap up with when considering partnerships to reduce food insecurity, of course, establishing the potential partners and identifying barriers, adapting as things come up, and really engaging so that it's a two-way street. I thank you so much for your time.
Hi, everyone. I'm JJ, Senior Manager of Policy and External Relations for Arctera, or a barrier-focused environmental nonprofit that brings people together to create solutions for a healthy planet. Our roots go back to 1970, but Arctera's current focus is climate action. In the San Francisco Bay Area, food is one of the biggest contributors to the average person's carbon footprint. So Arctera's Healthy Plate, Healthy Planet program promotes plant-rich eating and food waste reduction by residents, institutions, and local communities for better personal health and to help lower our collective carbon footprint. This January, Arctera launched our first Be-Anguary Your Way challenge to go plant forward in the new year. Participants signed up for a dietary pledge where they approach plant forward eating within their own comfort level. We held a second challenge, Meatless May, and had double the participation. Between the two challenges, participants reduced their carbon footprint by more than 3,000 pounds of CO2 equivalent, or over 3,500 miles driven by your average gas-powered car. It turns out that making simple and easy changes to your diet can really make a difference. Much of Arctera's food-related policy work is focused on improving soil health by bolstering the adoption of conservation agriculture. What I and many others find so exciting about improving soil health is that it is an investment in addressing food scarcity, water scarcity, and climate change that is also extremely cost-effective when compared to alternatives. This year, we are lobbying in favor of a bill authored by Assemblymember Robert Rivas that, among other things, would provide grants and technical support for food producers to implement practices that to increase carbon sequestration and reduce greenhouse gas emissions. AB 125 will also provide funding for community colleges, universities, and qualified nonprofits to train farmers, ranchers, and agricultural workers in business planning and farm management. Arctera is also working to recruit organizations from across the region to join our homegrown Bay Area coalition. Our goal and strategic vision is to engage with all cities, towns, and county governments across the Bay Area in an effort to get commitments to policy, purchasing, and programming that makes healthy food, which is predominantly plant-based and minimally processed, accessible and affordable for all, supports small local farms, including urban farms with sustainable and carbon-reducing farming methods, prioritizes and ensures the safety and well-being of food workers, and minimizes the loss and waste of food from farm to fork. We will be having a coalition kickoff meeting September 28th. Feel free to reach out to me at jared.johnson@arctera.org if your organization is interested in joining. Also remember to hang out with Robbie, our Healthy Plate, Healthy Planet Program Manager for Arctera's Happy Hour. He can tell you more about some of the other great events Arctera is holding this year. Thank you for watching.
Hello, we wanted to introduce you to the Olive Eats Circular Food Economy for Alameda County. For us, that encompasses 5 different components. The first, it starts with growing the food, which we call produce. Then we aggregate all of the different types of food that we have within our circular food economy at our food hubs. We have processing, which means we're turning really healthy food grown regeneratively into prepared meals that are really healthy. Then we distribute those within the community. And finally, we recover food from within the community, from grocery stores, schools, and restaurants, and anything that we can't eat, we recover and put back into the soil as compost. And that's what brings it full circle. And so this is our circular food economy. We want to expand what we're doing in the production phase of our circular food economy. And for us, that started with passing a good food purchasing policy, which we did in January of 2021. From there, we want to increase the number of urban farms that are around Alameda County, codify some farm standards based on the regenerative and permaculture agriculture methods, and then form this urban farmer collective so they can bid together on selling their produce to large institutional buyers. In order to expand this part of our circular food economy, we need more food hubs throughout the Alameda County. And for us, that means working with cities, nonprofits, and other organizations that have underutilized commercial kitchens that we can put into use as new food hubs that can function in the same way that our current food hub does. We're working with many partners to try and make this possible. And then in addition to that, we're trying to drive demand for the products that are produced within the food hub. And for that, we're working with institutional large partners such as hospitals, schools, and large businesses in order to drive a demand for things like lightly produced foods such as diced, sliced, and spiraled vegetables that can be prepared within the food hub as a source of another business opportunity for people within the community. To increase the production within our processing phase, we have several things that we're working on. First, we developed some nutrition standards for all of the food vendors who are producing food within our collective. And we're also helping them adapt those food nutrition standards to their cultural meal types. In addition to that, we're working on several policy initiatives, most importantly, AB 368, which was formerly 3118, and that is for the purposes of developing policies that allow food to be a covered benefit through Medi-Cal. And that's going to allow people in the future to be able to use Medi-Cal in order to get the produce and prepared meals. In addition to that, we are working on ways for people to use their SNAP benefits to purchase food produced by our local food vendors online. And that means we're using federal dollars for both of these things to help circulate more money within our community. Finally, we're working on a food vendor collaborative, which is this group of the food vendors coming together so they can bid on larger contracts. To expand our distribution system, we are working on getting more vans and more positions for drivers in order to increase the delivery that we're doing currently. We're also going to be developing an all-in-eats mobile app, which will function much like a DoorDash or a Grubhub, but more affordable for everybody within the system, more affordable for the food vendors producing the food, and more affordable for those who are purchasing the food. Additionally, we are going to be working in functionality so people can use their SNAP benefits to pay for the food, both produce and prepared meals, through the food app. And finally, of course, we're expanding the food as medicine clinics throughout the county and working with partners who are already developing their own food as medicine programs. So in expanding this section, we need to increase the amount of food that we are recovering. And for that, we require all of the other elements. We need more food hubs, more vans, more drivers, and the whole system needs to expand. This will allow us to support our work within the county and support cities as they're trying to meet the SB 1383 compliance requirements for food recovery. And finally, of course, that allows us to put food back into our food production system, which brings it full circle. All of these steps, when they come together, create a lot of benefits for the community as a whole. We have big visions to expand this circular food economy within Alameda County. And with that, when we do that, we think there's going to be some very big dividends, as you see here. Over 300 new jobs will be created as farmers, pharmacists within the food hubs, as well as drivers. We're going to be reducing the carbon emissions within the county, both through regenerative agriculture and then through food recovery. We're going to be incubating 52 plus businesses within the food hubs, recycling millions of pounds of food, helping over 6,000 patients through food as medicine program, which improves their health, their own personal productivity, their own ability to earn money, as well as save medical expenses, and then shrinking food security at the same time. All of it comes together again in this whole circular food economy of Alameda County. Thank you very much for listening to us today. If you have any questions, please get in touch.
We hope to partner with you soon.
All right. Thank you so much. I hope you enjoyed these lightning talks as much as I did, and feel free to reach out to any of the speakers for any questions or concerns on your own time. But now I want to introduce Dr. Reshma Shaw, who's going to help us bring some of these concepts together. She's a pediatrician and the author of Nourish, the definitive plant-based nutrition guide for families, as well as one of the faculty mentors for the Climate Symposium. Dr. Shaw?
Okay. So as we've seen from the previous talks, food sits at the center of so many of the conversations that matter most to us. It speaks to our culture, our values, it shapes our health, our communities, and our collective well-being. And the COVID-19 pandemic and other world events have exposed long-standing problems with the ways in which we feed our communities. We've seen a dramatic increase in hunger and food insecurity, and the pandemic has also exposed health disparities that exist in low-income and under-resourced communities. As Dr. Katz emphasized, we've known for quite some time that poor nutrition is the single leading contributor to chronic disease and premature death. It's estimated that 80% of heart attacks, 90% of type 2 diabetes cases, and 30 to 70% of cancers, as well as a whole host of other conditions from stroke, dementia, and so much more, are attributable to dietary risk factors. Plant-based diets have been associated with longevity, reduced all-cause mortality, and a reduced risk of many of the chronic diseases that lead to poor health. It's remarkable to know that the same diet that can improve health outcomes is also a key answer to the greatest existential threat of our lifetimes, and certainly the lifetimes of our children, which of course is the climate crisis. The most recent report from the Intergovernmental Panel on Climate Change from just a few weeks ago doesn't sound a new alarm, but rather a louder alarm. And in fact, the UN Secretary General described the findings as a code red for humanity, requiring immediate, rapid, and large-scale reductions in greenhouse gas emissions. Animal agriculture takes an enormous toll on our planet. 60% of all land capable of growing crops is used to grow food for livestock. Some experts estimate that if we were to divert this feed to simply feed humans, we could largely solve the problem of world hunger. A third of the Earth's fresh water goes to livestock, and animal agriculture is responsible for over 90% of Amazonian deforestation. It's also the leading cause of species extinction, ocean dead zones, and water pollution. Additionally, roughly 70% of the antibiotics produced globally are used for animal agriculture, which is not only harmful to the animals receiving these antibiotics, but is also a major cause of antibiotic resistance, which the World Health Organization identifies as one of the biggest threats to global health. The health effects of climate change are a consequence of extreme weather events, including excessive heat, hurricanes and floods, poor air quality, vector and waterborne diseases, droughts, and issues related to food safety and nutrition and mental health. Children, the elderly, and other vulnerable communities, including lower income families and communities of color, are often the most directly impacted by climate change, even though they are the least responsible for its causes. Over and over again, plant-based diets have been shown to be the most climate-friendly diet. In fact, the Eat Lancet Commission on Food, Planet, and Health, which Dr. Katz also mentioned, is a committee of experts from a variety of fields around the world looking to answer the question of, can we feed a future population of 10 billion people a healthy diet within planetary boundaries? The commission concluded that food is the single strongest lever to optimize human health and environmental sustainability on Earth, and that a diet rich in plant-based foods and with fewer animal source foods confers both improved health and environmental benefits. On top of that, animal agriculture causes an immense amount of suffering. More than 10 billion farm animals are slaughtered for food each year in the United States. And the United States is amongst the lowest ranking countries when it comes to animal welfare. And this also translates to human health outcomes when you consider the hazards that workers in these slaughterhouses and meatpacking facilities endure. During the pandemic, reports showed roughly 300,000 excess cases of COVID-19 and 5,000 deaths among workers in meat processing facilities, the majority of whom were immigrants, refugees, and people of color. While the problems and systems are complex, making plant-based diets more accessible and mainstream offers us a way to promote health, protect our planet, and build equity and justice. As healthcare professionals, community leaders, and activists, we are in a position to be agents of change and can help to guide the way. Healthy food that protects people and the planet should be a right and not a privilege. And ensuring access to healthy, sustainable diets, especially in under-resourced and marginalized communities, is a moral imperative for the sake of our health, the climate, and to build just and equitable communities.
Thank you so, so much, Dr. Shaw. Our session around food is only scratching the surface of a very, very large discussion. We have to wrap up this engaging talk as we're nearing the end of our session, and we'd love to hand it off to Ode for a presentation of our toolkit and some next concrete actionable steps. Ode?
Thank you so much, Sahila. Hi everyone, my name is Ode and I'm a neuroscientist and medical student at UCSF. We really thank you for attending our session and hope you found the keynote and lightning talks informative and inspiring. To help you figure out how you can take action today and into the future, we've created an interactive toolkit to complement our session. The toolkit is framed in 3 main sections. The first includes additional resources for you to learn more about the complex relationships between food, climate, and health equity, and the roles that health professionals and academic medical centers can play in transforming the landscape. You'll find many, many links to additional readings, videos, podcasts, and books to learn about how the global food system is inextricably linked to the ongoing fight for racial justice, land sovereignty, climate resilience, and health equity. You will also find more information on how to weave an environmental nutritional approach into your own life and clinical practice, and how to think about the transformational role that healthcare institutions can play as anchors in their local community to address upstream determinants of health. We know the work of changing habits, cultures, and policies around food systems is really hard and cannot be done alone or in silos. To help you find new friends and community, we've also included a section that will allow you to connect with the sustainability champions at your own institution. You'll find links for you to connect with the relevant climate and health Slack channels at your own institution, and suggested ways for you to align your individual efforts with system-wide goals. And lastly, you'll find more information on all of today's speakers and ways to connect with their work. We'll drop a link to this toolkit in the chat and follow up with you in an email as well. From going plant-based 1 night a week, or supporting small Black-owned farms and businesses, or influencing food policy at your own institution and community, there's so much you can do to help improve food, climate, and health justice. Yeah. Marcella, let's take on from here.
All right, after hearing about the interactive toolkit from Ode, we now invite all of you to try new strategies that may improve your personal health, the health of your community, or the health of our planet. At this time, we would love to hear from our audience about some commitments or goals that you have or will implement to hopefully support our food systems through the lens of climate, health, and equity. I'd like to invite a couple of our team members to start off and invite all of our audience members in the chat. So Hala, what goal or commitment will you make moving forward after this symposium?
Yeah, I'm so excited to get started on a lot of different things, but definitely wanting to start on community gardens and getting more involved with local food banks.
Ode, I'd like to invite you to share on what sort of actions or steps you will take to support climate, health, and equity with your food choices.
Thanks, Marcella. I thought you'd never ask. I hope to keep pushing for food and preventive health frameworks within the medical education curriculum.
Dr. Reshma Shaw, I'd like you to share a potential strategy that you will make moving forward as well.
I am going to try and cook as amazing plant-based foods for as many people that will come to my home when we can all start meeting in person. So I'm going to do a lot more cooking for people to persuade them.
And I invite you all in the chat again to share some actionable steps as we wrap up our session on the food systems portion of the symposium on climate, health, and equity.
Amazing. Thank you so, so much, Marcella. All right. So again, this is just scratching the surface and beginning of a conversation that is very crucial for improving our climate, health, and equity. Thank you so, so much again for all of you for attending our session, and to Dr. David Katz, to all of our lightning round speakers, Dr. Shaw and Ode for that amazing toolkit presentation. And please, please do not let this be the only time you discuss this or have a conversation about food equity within your communities. Distribute the toolkit, just leave away with all of the things that you've learned today and just use it in your respective communities and respective workplaces. And thank you again for coming today. And with that, please head over to the NorCal Symposium agenda again as we head to our next session that starts at about 2:30. Oh yes, and again, if Actera, who we heard from during our lightning round speakers, is having a happy hour. So we'll put the link in the chat in case you are interested in attending. It is a Facebook event, so you just have to join the Facebook. And I see some wonderful suggestions in the chat: carpooling to work, compost, of course. Vegan at home, vegan before 6. I might start that too. Okay, and let me, oh, and thank you so much, Lena. Lena put the link to the agenda, so feel free to use that link to direct yourself to the next session, which is a roundtable. Which is another session with medical education or wildfires and air pollution. I see a lot of trying to be vegan at home. Very excited.
Is there anyone still on that had any questions for Dr. Shaw or any of the panel? I see a few people. There's a few participants still hanging out.
I'm personally trying to read some of the chat, so I don't have any specific questions, but thank you for asking.
Oh, thank you for coming, Dr. Hamilton.
And again, the session is recorded, so we'll definitely have it up on the symposium website for anyone to go back, and we'll distribute the toolkit.
Hello.
Hello.
Hi, can you hear me?
Yes.
Excellent. This kind of came up in conversations with my peers throughout the past several years when it comes to veganism, and I'm curious to hear people's thoughts and strategies and just reflections about this notion that has been brought up in these conversations, how veganism or the movement in a way is not culturally inclusive when it comes to how much one's food is indicative of someone's cultural identity and their expression of it. And mainstream veganism, as I understand it, is a very kind of whitewashed sort of menu and approach. And I totally agree with all of the ethics when it comes to unethical treatment of animals and its devastating climate impact, all of these things that were brought up earlier. But I'm also trying to contend with a potential kind of erasure of certain cultural identities that are expressed through food.
Yeah.
I
was just going to say, I think it's a great question. And I think part of it starts with what Dr. Katz mentioned during his Q&A is it starts with listening. So I think, instead of going in and telling people what they should be eating, being curious about what those culturally appropriate diets look like. And when you look at the definition of sustainable diets set by the Food and Agriculture Organization, a key part of that is cultural relevance and that cultural acceptability. I think it's really interesting though, because when you look at a lot of cuisines from around the world, a lot of them are centered in plants, whether it's rice and beans or dal. I'm Indian. I think that you can find plant-based foods that are culturally acceptable. But I think it's a conversation that you have to sort of enter into with curiosity and with a lot of listening. But I also think that that should not prevent us or hold us back from pushing for more plant-centered diets. And then the last little thing I'll say before anyone else wants to jump in, I know we're probably going on to the next sessions, is when we ask for communities to shift their diets for the sake of planetary health, I think it's the people in a position of privilege who have the resources and who have the capacity to make the change. We bear a much greater responsibility. So if someone is struggling to just get food on the table, I would be less worried about trying to shift them towards a plant-based diet and more concerned about making sure that they have food security, that they have enough to eat. But for those of us who are privileged enough to be able to have some choice in terms of what we're eating, we bear a much, much greater responsibility. I don't know if that answers your question sufficiently.
No, thank you. I don't think the answer to this question is very complex, and I appreciate your reflection points.
I would say one thing to add to that would be within somebody's cultural identity in how it relates to food, one can still shift. So if you're used to eating lots of pork and beef and beans and rice, maybe put more of the beans and more of the vegetables on the plate and less of the pork. Or, you can also try and slowly shift in one direction.
And I mentioned in the chat too, when I, go to developing countries, the majority of people that don't have money do eat a plant-based diet that is their culture in Central America and Africa. It's the growing middle class and upper class that are demanding the meat, but the very traditional diets of plant-based for the underserved.
Excellent information. Thank you so much.
Thank you.
Thank you for asking. It's a very important point.
All right.
All right, I think we have to go to the next session.
Yes, I think this is a really good stopping point for people to have like about 2 minutes to head to a session of their choice.
And
on either medical.
see you guys at the Actera happy hour.
Thank you, everybody. Thank you. So well done.
Sohail and Ode and Marcella, what a great job.
Yeah,
Great job you did.
very nice. Very nice.